Hi, this is Professor Ulrich. We are going to go very quickly regarding infection prevention and control. Since you did cover this material in your fundamentals class, I will be pointing out those key principles that you need to be familiar with. I will not read everything on the slide, just point out key words. Also, in the slides are orange boxes. It is very important that you review that information that is designated in each box regarding figures and tables and extra information in your textbook. Quizzes and case study questions we will review in class as well as some basic skills. Please bear with me as I continue to learn and improve in utilizing narrations with PowerPoint presentations. Be familiar with the nature of infection and about the entry and the multiplication of organisms which result in disease. Nature of infection, also understand the definition of systematic and asymptomatic and the importance of hand hygiene. Be familiar with the elements of a chain of infection. Remember that if this chain is intact, that a person is susceptible to acquiring an infection. Review the table and box on page 400 and 401 regarding transmission for further discussion. Additional terminology. Be familiar with these terms and how you can protect yourself from infections. Quick quizzes. We will go over answers to quick quizzes as well as case studies during the Skill Lab session. Determine what is the best answer for this question. There are 4 stages. Be familiar with the incubation, prodromal, illness stage, and the convalescent. And review on page 401 the box regarding course of infection by stages, which gives specific examples of these 4 stages. Normal flora. Remember that the body has a defense system. Be familiar with the organs that are helping us to prevent infections. And where are these floras located? Also remember that floras are located in the skin, saliva, oral mucosa, and intestinal walls. Review page 402, table 28.2, the normal defense mechanisms against infections. Inflammation. Be familiar with the vascular and cellular responses. Also, the signs of local inflammation and infection are identical. Again, here is our case study. Mrs. Eldridge, she's 68, just had a hip replacement. Kathy is her nursing student who's taking care of her. After 2 weeks, Mrs. Eldridge complains of pain and low-grade fever. Kathy observes the incision and notes that it's red, swollen, and warm. So what do the fever and the warm, swollen incision likely indicate? Is an infection at a wound site likely to be systemic or localized? Healthcare-associated infections occur as a result of healthcare services. Be familiar that patients are at great risk. If they have multiple illnesses, older adults, poorly nutrition, or lower resistance to infection. Please review on page 404 the box regarding focus on older adults. Types of HAI are iatrogenic, exogenous, and endogenous. Risk factors. Be familiar with these risk factors and also major sites for healthcare associated infections. Review the box on 404 regarding sites for and cause of healthcare associated infections. Factors influence infection prevention and control. Be familiar with these factors and what conditions can you think of that would make a patient more susceptible to infection. Mrs. Eldredge's wound was infected. She was admitted, started with IV antibiotics. At present, the wound remains open but it's healing with new granulation. And what is granulation tissue? Nursing process assessment includes a thorough investigation, review system, travel history, very important, immunization and vaccinations. Very important for early recognition of risk factors. Review page 406, nursing assessment questions in box 285. Continuing on with the nursing process assessment, always remember to see through the patient's eyes and review page 405 and 407 tables and what are the factors that influence patient susceptibility. So here's another quick quiz. Consider what is the best answer to this question. Nursing diagnosis for infection. Here are some examples. Be familiar with these. Also review box 28-6 regarding nursing diagnostics process. Risk for infection related to impaired immunity. Goals and outcomes. Common goals of care applicable to patients with infection often include the following. Also review the concept map on figure 28-2, page 409. Setting priorities. Setting priorities is really important. You need to establish priorities for each diagnosis for related goals of care. Remember to plan care and include other disciplines as necessary. Review page 408 regarding the examples of a nursing care plan on risk for infection. Here, Mrs. Eldredge continues to recover at home. Kathy visits her, teaches her about infection prevention and control practices. So consider what outcome would you set for this activity, and what are some examples of teaching strategies to achieve this? Health promotions, preventing an infection from developing or spreading. Review page 410, box 28-7 regarding cultural aspects of care. Implications for infection control. Continuing on with implementation, when implementing, consider these factors. Be familiar with what asepsis means and medical asepsis or clean technique and the difference to surgical asepsis or sterile technique. Be familiar with standard precautions and also hand hygiene includes using alcohol hand antiseptics. If they are visibly soiled though, you should wash your hands. Hand washing is the act of washing hands with soap and water followed by rinsing under a stream of water for 15 seconds. Please review on page 411 the box regarding evidence-based practices, pathogens, and artificial fingernails. Be familiar with the difference between disinfectants and sterilization, and also review on page 412 and 13 the box and table regarding examples of disinfection, sterilization, and categories of sterilization and disinfection and cleaning. Be cognizant, be aware of patient safety and the practices that promotes patient safety. Review on page 413 and 414 and 421 regarding infection prevention control for reduced reservoirs of infection and CDC prevention isolation guidelines, as well as infection prevention control protecting the susceptible host and patient teaching infection prevention and control. Always remember in cough etiquette those principles that also help prevent and control infections. Isolation and isolation precautions. Be familiar with isolation precautions related to airborne, droplet contact, and protective environment. Isolation. Be aware of the psychological implications of isolation. Also review box 2812 on page 417 through 418. Also box 419 and the box on 420 regarding specimen collection techniques. Remember, surgical asepsis includes procedures used to eliminate all microorganisms, including pathogens and spores, from an object or area. Frequently, you place sterile objects on a sterile towel. Remember, the edge of the drape touches an unsterile surface. Therefore, a 1-inch border around the drape is considered contaminated. Very important, because surgical asepsis require exact technique, you need to have the patient's cooperation. Make sure you explain to them what you're going to do and why. Principles of sterile asepsis. Be familiar with these principles. When beginning a surgical aseptic procedure, nurses follow certain principles to ensure maintenance of asepsis. Failure to follow these principles places patients at risk for infection. Assemble all of the equipment that you will need before a procedure. Have a few extra supplies. When performing sterile procedures, you need a sterile work area that provides room for handling and placing sterile items. Never ask a patient to use their lap and to hold something that is sterile. You need to place everything within the sterile field. The bottle containing a sterile solution is sterile on the inside and contaminated on the outside. The neck of the bottle is also contaminated, but the inside of the bottle cap is considered sterile. Upon evaluation, always remember to see through the patient's eyes and consider, have the patient's expectations been met? The patient at risk for infection needs to understand the measures needed to reduce or prevent microorganisms growth and spreading. Documentation of the patient's response to therapy is critically important. Be familiar with exposure issues. The CDC is the Center of Disease Control and Prevention, has published a list of recommended immunizations and vaccines for healthcare workers. Please review box 28-16. In conclusion, since this material was covered in fundamental, what we have done is just highlighted those areas that you need to be familiar with regarding infection prevention and control. We will review case study questions and quiz questions in Skills Lab and practice these skills.